Hey, this is not so complicated, presenting you on 5 minutes 5 high yield drugs, and this time we are doing Endocrine Pharmacology episode 4, and it includes insulin, metformin, levothyroxine, hydrocortisone, and propylthiouracil. So without further delay, let's begin. From insulin, so it is actually pancreatic hormone analog, and the uses are obviously type 1 diabetes and type 2 diabetes, and also in diabetic ketoacidosis, which is diabetic emergencies. The mechanism of action of this drug is that it binds insulin receptors, promoting glucose uptake by a GLUT4 translocation, and also it inhibits gluconeogenesis, which is the formation of glucose from non-carbohydrate sources, right? The types of insulin that are in use right now are rapid, as in lispro, and short acting, as in regular, and intermediate acting as in NPH, and long acting as in glargine. So we mix this rapid and long acting to do the tight control actually. And the side effects are hypoglycemia if there is insulin overdose, and weight gain, and also lipodystrophy because of repeated subcutaneous injection. The USMLE poll for this drug is that you have to administer regular insulin IV intravenous for DKA, that is diabetic ketoacidosis, and also monitor potassium for hypokalemia risk. We have to match regimen to patient. Example, basal bolus for type 1. So case example is that type 1 diabetic with hyperglycemia starts insulin lispro and glargine for tight control, right? So the other drug that we have is metformin, which belongs to class biguanide. So the uses of this drug is type 2 diabetes. This is first line drug for type 2 diabetes, and polycystic ovarian syndrome, also PCOS. And the mechanism of action of this drug is that it decreases hepatic gluconeogenesis, and also it increases insulin sensitivity, and then it inhibits mitochondrial complex 1. These all are the mechanism of action, and the side effects are GI upset, gastrointestinal upset, lactic acidosis, which is rare, so we have to avoid in renal failure, and vitamin B12 deficiency because of decrease in absorption of this vitamin, right? So the USMLE poll for this drug is that it is first line for type 2 diabetes, and it is contraindicated if glomerular filtration rate is less than 30 ml per minute. The example case of this drug is obese type 2 diabetic starts metformin to improve glycemic control and weight. The other drug that we have is levothyroxine. It belongs to class synthetic T4 thyroid hormone. The uses are hypothyroidism, myxedema, coma, which is hypothyroidism like emergency, thyroid emergency, and also thyroid stimulating hormone suppression and thyroid carcinoma. And also the mechanism of action of this drug is that it converts triiodothyronine, that is T3, regulating metabolism via nuclear receptors, and also it increases basal metabolic rate. So the side effects are everything that increase basal metabolic rate, like hypothyroidism symptoms like tachycardia, weight loss, and diarrhea, and osteoporosis with overdose can happen. The USMLE poll for this drug is that it has to be taken on empty stomach, and we have to monitor TSS, adjust dose slowly, because the half-life of this drug is 7 days, almost 7 days. And the example case is that Hashimoto's patient with fatigue and high TSS starts levothyroxine titrated to normalized TSH. The other drug that we have here is hydrocortisone. It belongs to class glucocorticoids, and the uses are adrenal insufficiency, autoimmune diseases, acute inflammation. The mechanism of action is that it binds glucocorticoid receptors and inhibiting inflammatory cytokines, obviously suppressing immune response. So in long term, it can cause opportunistic inflammations, right? The side effects of this drug is Cushingoid features if there is overuse, and osteoporosis, hyperglycemia, also called adrenal diabetes, and adrenal suppression can occur. And the USMLE poll is that we have to taper this drug, right? Increasing to decreasing drug uses in doses to avoid adrenal crisis, double dose in stress, like example surgery for Addison's, right? The example case is Addison's patient with fatigue and hypertension uses hydrocortisone for cortisol replacement. The other drug we have is propylthiouracil. It belongs to class thiamide. The uses are hyperthyroidism like Graves' disease and thyroid storm. The mechanism of action is that it inhibits thyroid peroxidase enzyme, blocking T3, T4 synthesis, also inhibits T4 to T3 conversion. And T3 is the viable hormone actually, right? So the side effects are agranulocytosis, hepatotoxicity, rashes, and also teratogenic. So we have to avoid in first trimester. And the USMLE poll for this drug is it is preferred in pregnancy first trimester over methimazole because of low penetration rate in the fetus, right? So we have to monitor CBC for our granulocytosis and LFT's lung function test for hepatotoxicity risk. The example is Graves' patient with palpitations, that is one becoming aware of its own heartbeat, starts propylthiouracil to control thyroid hormone production. So that is all for today. Subscribe for daily doses like this, and thank you for staying with me. Thank you.